right, Nutcracker Syndrome. This is a doozy. So when it comes to Nutcracker Syndrome, let's go ahead and kind of explain what it is. So Nutcracker Syndrome is the compression of the left renal vein between the aorta and the superior mesenteric artery, also known as the SMA. So I guess how this all started. So about a year ago, it was in May of 2025. I honestly just woke up with some random abdominal pain, kind of left side, mid-left side, kind of, I guess, just right to the left of the belly button, maybe a little bit higher. I just woke up with it one day. It wasn't going away. Lots of days of really bad pain. And then I had gone to my primary care because I wasn't sure what was going on. And she was honestly kind of confused with the kind of where the pain was located, because it was a weird presentation. And it just wasn't really pointing to anything specific. So she went ahead and ordered a CT scan for me. So I went, did that, and it revealed Nutcracker Syndrome. So honestly, I'm mind blown that it actually showed up, or rather the radiologist actually read it and revealed that, because it's again a rare condition. So a lot of people will get a scan that looks completely normal, and they end up finding nothing. They don't know what's wrong. So I'm very happy that it just took one scan to find this. But anyway, so I went ahead and drew out a little diagram. Don't judge. I know it's a little precious. The kidneys are rough looking, but it will do the trick, okay? So anyway, so just to kind of explain, so the blue is going to be the veins and the red are the arteries. So for Nutcracker Syndrome, so right here, there's the blue vein going to this kidney, the left kidney. That is the left renal vein. So as you can tell, you have, this big red one right here, that is the aorta. And then this right here is the SMA. So as you can tell, the left renal vein is currently being compressed, or it sits between those two arteries. So in a normal person, the angle between those two arteries should be wide enough for that vein to just pass through, no problems. But I'm special, yay me, and that angle is not to where it should be. It's smaller. So because of that, it squeezes the left renal vein and causes that compression. So for arteries and stuff, the blood goes from the heart and goes down, goes away from the heart. So as the blood is going away from the heart, it goes into the kidney. So this left renal artery supplies blood to the kidney, and then the left renal vein, distributes the blood going from the kidney, and it goes back to the heart. Anyway, so as the blood is going from the kidney, you have that blockage right there. So there's not enough room for that blood to flow properly. So then it, kind of builds up. You get that increased pressure, higher velocities, and it causes all of this pain and all these different symptoms and whatever. So that's kind of how that works, I guess. Obviously, it's not the best description. I'm obviously not a doctor, but that's kind of just my understanding of it. So, funny enough, again, like I said earlier, I am special, and I actually have two left renal veins. I don't really know exactly where that second left renal vein is, but I do feel like it has contributed to my condition, where my compression doesn't look as severe as it is. So I think one of the big issues when it comes to the medical field with these conditions is these doctors read more into how the compression looks on paper, on the scans, all that kind of stuff, but they don't look they don't combine that with how the patient's actually feeling. So if the compression doesn't look severe enough on paper, then they're just like, oh, well, it's not that bad, you're fine, and they just kind of blow you off. And then, that's where gaslighting comes in. And that's kind of what I've been through with this condition. My compression doesn't look quite as severe on the scans, but my pain is definitely severe. So when it comes to the pain locations of Nutcracker syndrome, so you can get pain, typically it's, left flank, it's related to the kidney, so left flank makes sense. And then for me, it's been a lot in the abdomen as well, typically right underneath that left rib cage. So that's kind of where my main pain has been. There are a lot of days where I struggle just to get out of bed, and it's hard. The pain is very bad. And I mean, yes, it could be a lot worse. I know a lot of people will, have gone through a lot worse pain. But it's definitely not just a blow it off kind of condition. Anyway, so that's kind of two different areas where that pain can be. It can also cause pain in your pelvis due to blood backflowing into other veins and kind of causing more of a pelvic congestion syndrome, which is another condition, which it doesn't seem like I have, at least from what they've seen on scans so far. But yeah, so that's kind of where that is. And then some people will actually have pain on the right side, even though the compression's on the left side. And because of that, that's another reason why it gets misdiagnosed or underdiagnosed, because a lot of vascular doctors aren't, educated in that part of things where, I don't know, they just read into the normal symptoms. And because of that, they assume that pain can't be on the right side. But when you have different collaterals where blood is going into different veins that it shouldn't be going into, then that blood builds up and causes pain in other areas. So you could get pain in your back, or again, right side, pelvis, like all these different areas. It's different with everyone, honestly. So it's not just a, one symptom fits all. So that's where a big, roadblock has come when it comes to these conditions and in the medical field. So at least from what I've seen. With all of that being said, there's also some other symptoms, obviously, that go into this condition. And one of the other main things is you will get blood in your urine. So it may be more microscopic, or you might actually physically see it. So that's another thing. So if you're losing blood in more areas, then you could get anemia, and it could cause dizziness, and it's just kind of a domino effect, really. And then also another thing is it can cause constant UTIs, or rather your analysis will show up kind of looking similar to a UTI, but it actually isn't. So this condition is just, there's so much information in it, and it's just a lot. But anyway, so those are kind of the different symptoms that you might get from this condition. And for me, I do have a lot of that, but my main issue is, again, the pain. So a lot of people are normal and pain medications work for them in some way, shape, or form. But for me, pain meds do not affect me. It doesn't matter how strong the pain medication is, or just how, just over-the-counter medicine. I've tried, it feels like everything under the sun, and nothing helps. Strange enough, the only thing that has actually helped me with pain is IV Dilaudid, which isn't great, especially as a 23-year-old. So you can't just, walk into the hospital and be like, yo, I need some Dilaudid, definitely doesn't look great. So you just got to push through the pain, which isn't great, especially when you have flare-up days where you cannot get out of bed. So it's a struggle, but you gotta just push through, I guess. So that's been my main issue, which is why I miss so many different events, and it's hard, like canceling plans with people because you're in so much pain and there's nothing that takes it away. I've tried everything, even non-medications, it's just nothing works and it sucks. But yeah, so that's been my main issue when it comes to this condition. But yeah, so, and along with Nutcracker Syndrome too, which is another thing that isn't researched enough, is headaches. So headaches can actually be caused by Nutcracker Syndrome as well. And right now I've been having headaches for like, I guess a little over a month now, and no one really knows what's causing it. It may be the Nutcracker Syndrome, it may be something completely different. I'm not sure. I'm trying to figure that out currently, but it's one thing that, you know, people, a lot of doctors will see and they're like, oh, it can't be Nutcracker Syndrome. Nutcracker Syndrome has to do with your kidney, you know, or the vein going to your kidney. Like, why would it cause headaches? But the people that are actual like Nutcracker Syndrome specialists, like one of the surgeons in Utah that I have an appointment with to, you know, hopefully get a surgery that I need. He is educated enough and knows enough about this syndrome that, you know, he knows that headaches can be caused by it. They've had a lot of patients that have come in with headaches being caused by it. So anyway, that's just another, you know, symptom that could just be related to Nutcracker Syndrome or just something completely different. Anyway, so going into surgery, there's a few different surgeries that you can get when it comes to Nutcracker Syndrome, and it's a lot. You have to do your research on it for sure. And something that's been huge for me is the Nutcracker Syndrome support groups on Facebook. I know, you know, Facebook is for old people, whatever. You know, it's helpful. So anyway, so with that support group, I've learned a lot. I could definitely learn a lot more, obviously, but with that, I've learned kind of the surgeries that I should be going for. Anyway, let me go into those surgeries. So there is the left renal vein transposition, I think it's called, where the surgeon will basically just completely like take your, you know, left renal vein and move it away from that compression. So it should bypass it. But there's a problem with that where there is always that chance, a good chance, where it could actually, that vein can recompress. Especially if you have another underlying condition, some kind of connective tissue disorder, or something called Ehlers-Danlos syndrome, which is another thing that I am possibly being evaluated for. So yeah, with that, it makes you have a higher chance of, or I guess it makes that surgery have a higher chance of failing or that vein recompressing. So that surgery isn't fully an option for me, especially since I also have 2 left renal veins. So it would just make the surgery a lot more complicated, and I just don't see it as a good option for me. So the surgery that I have been looking into is the renal auto transplant, and that is, let me take out this diagram again. So they would take your kidney here, and they would move it to your lower abdomen. So I think the typical thing that they'll do is they'll take your kidney, your left kidney, and move it down below your right kidney, somewhere in this area. I think they typically connect it to your iliac vein here. So I think that's typically how that surgery works. In some cases, they will actually keep it on the left side and connect it to this iliac vein instead. And that's kind of where May-Thurner syndrome comes in. So if you have, you know, May-Thurner syndrome, that could also complicate things, and yeah. But anyway, we will get into that in the next video for May-Thurner syndrome. Anyway, so that's the surgery that I have been leaning more towards. It has a very high success rate, which is great. Obviously, you would be moving the kidney and the vein to different locations, so it would bypass that compression. So again, that's where I'm leaning more towards, but I've had some complications. My first referral had gone out to the University of Wisconsin, where they have great surgeons, but because I have stents due to May-Thurner syndrome, that has complicated the situation, and I was denied surgery there because of the stents. Again, I will go into those details a little bit more later. So anyway, because of that, I had to get my referral sent elsewhere, which is where the surgeon in Utah comes in. So this surgeon takes on very complex cases, from what I've heard. And so he is basically my last chance when it comes to getting the surgery. And if he can't do it, then I would have to move on to the last surgery option, which is a nephrectomy. So I would basically be losing a kidney. So they would take my left kidney, and the goal would be to actually donate it, not just get rid of it, obviously. So I would be donating my left kidney, which is, it's a great option, because I mean, you'd be giving your kidney to someone else, but at the same time, I am young, and I would be losing a kidney very young in life. And although there are a lot of people that live long with just one kidney, it's definitely a high risk surgery for that scenario, but it would completely bypass the compression and get rid of it altogether. So it's obviously the highest success rate because it gets rid of the condition altogether. But again, it carries its own risks for sure. But yeah, so that's those are all the surgical options, I guess. There might be some other ones, but those are, I guess, the main ones. So yeah, that's Nutcracker Syndrome for you. Yeah, if you have Nutcracker Syndrome or have any more questions about it, I can do my best to answer them, or I would just love to get to know you. But yeah, I appreciate all that watch this video, and we're gonna move right along to May-Thurner syndrome. So I guess we'll hop on over to that video. I appreciate you all watching. Thanks.